All right, you see the celebrities do it all the time, beauty treatments that enhance their look. More and more people are asking for injectables to perfect their pout, their lips, and around their mouth. Dr. Kimberly Butterwick is here with a new product called Restylane Silk. Thank you so much for coming in. We do appreciate it.
Thank you.
Okay, so talk about Restylane Silk for a moment, because this is newer to the market compared to the Restylane that's been out there for quite some time.
Right. This product, Restylane Silk, was FDA approved last year, but it's the only product that's been developed just for fine lines and lip enhancement. It's been approved by the FDA. It's a real fine particle, so when we put it in, it's very soft and natural. It moves normally. It's just a great product for the lips.
Okay, because I have seen, and I have to be honest, I know some people out there that have had their lips done, and I can tell instantly. It almost sort of gives the appearance of what people know as duck lips. How do you make sure that that isn't the look you end up with when you're trying something like this?
Well, we've all seen those people, and most of my patients are afraid of looking like that, so they're afraid to get filler. But that's a function of two things. One, the way the product is put in, you have to pay attention to the natural anatomy, the cupid's bow, the smoothness and shape and balance of the lips. And if you don't pay attention to that, it'll look unnatural. But two, sometimes a stiff, thick product is put in and too much in the upper lip, and it'll swell out and give that terrible duck lip
Okay,
look.
so let's look at some before and after pictures this morning so we can see when you apply Restylane Silk what it looks like for people who try this particular product before and after. I don't know if we have those, but we'll wait a moment here and see. There we go. Okay, so there's before on the left and after is on the right. So I can definitely tell from the after picture that the lines in her lips are certainly diminished.
Right, this is great for the smoker's lines and the lines around the lip. And she's just probably had a little bit placed in the lip as well. So it's prettier when her lip liner will go on, and with lipstick on, it'll just bring the pout out and help with those lines that deteriorate as we age.
Okay, so that sort of helped her with those lines. What about if you wanted a fuller lip? Would this be the right product for that?
I think she's had a little bit in her lip. She was probably afraid to put too much, so then we might put a syringe just in the lips. And with Restylane Silk, it will always look natural. No one will know you did the lips, so you can pop them a little more. That's what's nice about fillers that aren't too aggressive, because you can kind of add filler as you like till you get just the right look.
And you can do it right there in the office, right?
Right,
So
right.
So that way when you go home, the finished look is right there in the office. You don't go home and then hours later continues to swell, right?
Right. It'll swell a little bit, but the look you see when we're done, we have the patients look in the mirror and we talk about it as we go along, so you can just have it just how you like. There's usually a little bit of swelling for a few days, but those sort of mild side effects just disappear over a few days.
What about bruising? Is that something people need to be aware of?
Bruising is the main problem, because we all have busy lives and you wouldn't want to be bruised on TV. So we can make sure patients don't take aspirin, Advil, fish oil, and we also can laser it afterwards if there is a bruise to help it go away. And if we have a slow, careful technique, we can minimize that chance.
Now, how long would it last for? Because people may have an event coming up, a class reunion. How far in advance should they do it in order to make sure that they don't show up with bruises at their event?
Probably 2 or 3 weeks before. And in the clinical study with Restylane Silk, at 6 months, 75% of patients were still notice lip fullness. So it'll probably last in the order of 8, maybe 10 months.
Fantastic. Yeah. Okay. Anything else people tend to ask you when it comes to this? Any other concerns that are out there?
Well, they're usually concerned about the balance of the lip, the symmetry. The sides will roll in a little bit. So just paying attention to all those anatomical features can assure that you get a nice lip. And with the nice fillers that we have today with Restylane Silk, you don't have to be afraid. I think most of my patients, as I said, are afraid, and we want everyone to look natural and beautiful, because the lips are such a key feature of the face.
Right, it's like you have walking spokespeople out there all the time, so you want them to leave your office feeling perfect.
Right.
And because they're modeling what you're doing, so I totally understand that. All right, Dr. Kim Butterwick with the Cosmetic Laser Dermatology in the UTC area, if folks wanted to come visit you specifically.
Right.
All right, and the name of the product is Restylane Silk. Thank you so much for coming in.
Thank you.
We appreciate your time.